So I'd like to talk about mental health and use of Clozapine in Canberra, in Australia, and let's discuss the use of this drug and how people come to be put on the drug. Like, for someone like me who could not convince the doctors to give me an antipsychotic, an appropriate antipsychotic, I did not believe I had the type of mental illness that needed that, to someone who was then, who talked about their experiences in a different society and was deemed they need to be on Clozapine, which is a drug for treatment-resistant schizophrenia, and people who could not tolerate other drugs. And how do you become on these drugs when you were never given the opportunity to have a trial on the conventional antipsychotics, and which to you were more acceptable side effects, and with at the time the sort of myth that these neurotypical antipsychotics were superior and more effective, which is not true. You just take your pick of side effects, but being put on no drug to be putting on a drug like Clozapine. And if I'd known that it was more dangerous than any street drug, there's no way I would have agreed to take it, especially when my case was easily rectified. Just give me a non-sedating conventional antipsychotic, and then I take that, and then I just work and function, and a very mild, relatively moderate case with a high degree of insight, high functioning. I said I was functioning 75%, I wanted to function 95%. I thought if I got appropriate help, I'd do that. But talk about the doctor, to take things like, within Australia, normal coming out fears. When I was a young man, as a bisexual, nothing confronting. Ireland. Your mental illness combined with being a foreigner in the 1980s and 1990s, well, it's completely different kettle of fish than Australia. A rough corporation estate in Dublin is not a relatively privileged and safe Australia. I know there's dangerous areas in Australia, but on average, they're far rougher society than here, and far more intolerant at the time, at least. But to be put on a drug like Clozapine and having cardiomyopathy and severe cardiac effects, which any doctor, even a junior doctor, should know is what the side effect of Clozapine and the main reason for discontinuation. But for a doctor running the Clozapine clinic, not to know even the most basic side effects of the Clozapine is outrageous. And then after that, having severe neurological problems, which I did confirm from a neuropsychiatrist were legitimate, but they didn't really understand the action of the drug. And then months later, getting cancer from non-Hodgkin's lymphoma from the immunosuppression, which a hematologist was of the opinion it was probably caused by the medication. And then when the Clozapine was discontinued, there was residual neurological effects. So if I jumped up and down or moved the head, I got severe headaches, feel like burning and crushing in the skull, and Parkinsonism in the face, sort of felt like muscle paralysis was a leftover. But then when I just thought the effects was probably safe from that, I developed severe ulcerative colitis, and I had my bowel and my anus removed. It was so severe. I was exploding blood and feces everywhere, every half hour to an hour every day. And I was severely disabled, and these doctors were trying to stop me getting appropriate help for my illnesses because it might reflect on their competency. So I'm just wondering, sort of the side effects of clozapine. 1, cardiomyopathy, severe and disabling neurological symptoms, and some of them residual after even discontinuation of clozapine. Some forms of lymphatic cancer, and as though the association ulcerative colitis with clozapine. Now, it's ridiculous because someone like me, even without medication, or at least with antidepressants, I could pretty much do moderate study, moderate work, and a high degree of exercise to putting on a typical antipsychotic, and becoming a virtual vegetable, 40, 50 kg overweight, unable to do anything. So I've talked to people, the same genetics as me, did very well on the conventional antipsychotics like Clozapine or Flipentixel, and of course I'd ask for them and would be the obvious choice. But in the end, it comes down to doctors' incompetence, hiding what they done, lying about why they put you on the medication in the first place, as in all these bizarre, crazy claims about you, when my biggest coming out fear in Canberra was maybe get hassled, probably wouldn't, but maybe get beaten up. Everyday things in the 90s people were concerned about. Maybe if I was promiscuous, catching HIV. But nothing bizarre, nothing requiring a clozapine to treat the delusion. Because I've talked to clinical psychologists who said everything I had said was rational and true. So you had my files frozen because you couldn't substantiate any of your claims and all the lies you wrote about me. So I'm just wondering, Dr. Leslie, you silence your patients, and I've had friends in Canberra who have died of their antipsychotic medication, but it's never put on their death certificate just to tell what it was, but they don't say it's because of complications with medication. So I could have got better healthcare in a third world country, or just buying my own Clozapine or Flipentixel online from the third world, than going to a doctor. So I wonder whether cover up, stopping people getting access to essential services, access to essential physical healthcare as well, making it harder. I wonder if I could go back to being 20 years ago, being a young man, would I have just not gone on medication, or just put every bit of a resource to get a competent psychiatrist to make me a fulfilling life? As I said, I had a relatively okay life. My life now is a horror. I'm a disfigured physical and mental freak. So just think about if you approach these services, as I was told these services had changed and they're human rights conscious and don't believe the horror stories. Well, I can tell you what, any horror I thought, it was 5 times worse than anything I feared. Anyway, signing off, and have a good day, Canberra. Small town. And I'll just watch my friends drop off prematurely because medication kills, and incompetence kills even more prematurely.